Good afternoon. Welcome to the Finance Committee. Today is Thursday, March 21st. I am not going to read a bill order because it's going to change depending on which delegates show up. But we are going to start with our Speaker, Jones, and House Bill 602 is our first bill hearing for today. And Speaker Jones, thank you for being here. You can come to the podium if that's what you like.
It's the protocol.
You can begin when you're ready. And I notice my friend Jeremy Baker's here to answer questions.
Yes.
Here with the experts, Madam
Okay.
Chair.
Thank you. And thank you, Speaker, for
Okay,
being here.
all
Thank
right,
you.
I'm going to start. Good afternoon, Chair Bidle and members of the Senate Finance Committee. For the record, Speaker Adrian Jones. I'm here today to testify in support of House Bill 602, Employment Discrimination, Sexual Orientation. No Marylander should be discriminated against in the workplace, period. In fact, I believe that we need to do more to create stronger and safer cultures in all our workplaces. As part of that effort, House Bill 602 will ensure that Maryland employers cannot discriminate against workers due to their sexual orientation. Unfortunately, this summer, the Maryland Supreme Court ruled that our Equal Pay for Equal Work Act does not prohibit discrimination on basis of sexual orientation. This decision came after a lawsuit was brought by an employee of Catholic Relief Services who worked as a data analyst. With no notice, the organization abruptly terminated his legal spouse's health benefits after more than a year of coverage. Their reason? They discovered the couple's same-sex marriage. I think we are better than that. Equality, decency, and respect. These are the basic human values behind House Bill 602. People need to be able to go to work, feel safe at work, and be protected at work, regardless of who they love or who they are married to. We may disagree over politics, policy, or religion, but we should be able to come together as a legislature to say that all Maryland workers need to be treated fairly, with dignity, and yes, with decency. HB 602 passed on a wide bipartisan vote in the House, and I respectfully ask for a favorable report. Thank you, Madam Chair.
Thank you, Madam Speaker. Do we want to have Mr. Smith from the OAG's office next?
Sorry, excuse me. Good afternoon. My name is Jonathan Smith. I'm the Chief of the Civil Rights Division in the Office of Attorney General. Madam Chairman, members of the committee, thank you for allowing me to present this afternoon in support of House Bill 602. As the Speaker said, discrimination based on sexual orientation is far too often limits the ability of all Marylanders to fully participate in employment, and far too many LGBTQ plus people experience harassment or discrimination on the job. In August of 2023, the Maryland Supreme Court decided Doe versus Catholic Relief Services. Doe was brought by an employee of Catholic Relief Services alleging employment discrimination when the organization denied health coverage to his same-sex partner on the same terms as persons who were married to persons of the opposite sex. The Maryland Supreme Court held that sex does not apply to sexual orientation under the Maryland Equal Pay Act. The Supreme Court reasoned that because the legislature had expressly referenced sexual orientation in other statutes, it did not in these laws, it must be intended to exclude sexual orientation from that protection. The Doe decision stands in stark contrast to Bostick versus Clayton County in the United States Supreme Court, which held that sexual orientation was sex discrimination under the Title VII of the Civil Rights Act. This bill will address the gap in the law that was created by the Doe decision. I think it's important to note that the changes in the law will not affect the ministerial exception to the anti-discrimination provisions in Maryland law, and recognize that it recognized both by the Maryland Supreme Court and by the Supreme Court of the United States. The category of ministerial exception covers employees who will personify the entity's beliefs. In Doe versus Catholic Relief Services, the Maryland Supreme Court found the statutory exemption of Maryland law for religious institutions applies with respect to claims by employees who perform duties that directly further the core missions of the religious entities. For these reasons, we urge a favorable bill. Thank you.
Thank you. Now, these are all the favorables. Do we have any questions for Madam Speaker or for Attorney Smith? Senator Lamb.
Yeah, thank you, Madam Chair. Just a quick follow-up question to Mr. Smith. When I was looking at this, the favorable with amendment testimony notes that the Doe versus CRS decision has implications that extend beyond just sexual orientation.
Correct.
Because the court said that if we don't list a specific class, then a statute doesn't apply to that class specifically.
Correct.
Right? They were looking at that very narrowly. So for example, this equal pay law doesn't include race or disability.
Correct.
Would there be any openness to an expanded version of this bill that makes sure that we include all protected classes that are protected from discrimination, including, for example, race or disability?
Yeah, there is, I should know the bill title and I apologize. There's a second bill that's parallel to this bill that is also supported.
That's my
by
bill.
It's your bill. I now I'm really embarrassed. I'm sorry. If I'm turning bright red, please forgive me. Yes, we have supported that the Attorney General's office supports that bill. We believe that throughout the code, not only for these statutes, but for all statutes that protect against discrimination where there are the protected categories are listed, that those should be uniform throughout the code, and to go through and there's effectively to try to make sure that given the reasoning of the Supreme Court in the Doe decision, that the legislature be explicit about the values of the state to protect from discrimination across all of the domains in which people experience, our economy, access to education, ability to get licenses, housing, et cetera. And so we are in support of your bill. I got it right this time. This bill, we believe, solves very directly the problem in Doe and is an important bill. We believe that the broader issue needs to also be effectively addressed.
Okay, so just because the decision in Doe was very narrow, or it narrowed the interpretation that is in statute, saying that if it's not a protected class directly stated in the statute, then it's not protected generally, right? That's
Correct.
how the Supreme Court interpreted that.
That's
And
right.
so yours will add specifically sexual orientation. I think the more expanded bill will also include race and disability into all the parts of the statute where it's missing, so that based on this Maryland Supreme Court decision, we'll make sure that we cover all protected classes as originally intended.
Correct. And there are places in the code where religion isn't listed or
Right.
or gender identity or various other places. It's a byproduct of the way the legislative process works. You know better than I. The day that a legislation was passed, there may have been one set of categories or concerns that were being addressed without reference to what was happening more broadly across the code, and cleaning up the code more generally in light of what the court did in Doe, which I think surprised everybody, to be candidly, particularly after Bostock. I think is important. The rule that's articulated in Doe has implications that are much broader than just the question about whether sex means sexual orientation for the purposes of these two laws.
Right. Yeah, I agree. I think it was a surprising decision.
Yeah.
So, all right. Thank you.
Thank you very much.
Senator, do I have any other questions for the speaker or the attorney? I see no other questions. Thank you for your testimony.
Thank you very much.
There is a favorable with amendment. Madam Speaker, you're welcome to stay or leave, whatever your schedule permits. Camila Reynolds Dominicus. Favorable with amendment. Thank you.
Hi, good afternoon. My name is Camila Reynolds Dominguez, and I'm from Free State Justice. We are Maryland's LGBTQ pro bono legal services organization. We are in strong support of protecting Marylanders from employment discrimination that targets their sexual orientation, because we assist client after client, at least 50 per year, as they navigate the aftermath of harmful anti-LGBTQ workplace discrimination. This problem is pervasive, and we are thankful for the speaker's leadership on the issue. However, we have serious concerns with the limited scope of the bill. As you heard, this bill was drafted in response to the Maryland Supreme Court's ruling in John Doe v. CRS, which weakened the statutory protections afforded to all Marylanders under every state anti-discrimination clause. The court held that if a protected category of individual is not specifically enumerated in a given anti-discrimination clause, the omitted category does not get the protections of that clause, even if they're protected elsewhere. So this ruling is applicable not just to sexual orientation and employment, but to every single protected category currently enumerated anywhere in state law. We conducted a survey of anti-discrimination clauses and found that the enumerations of protected classes are extremely inconsistent, not just for sex, sexual orientation, and gender identity, but also disability, religious belief, and race, among others. Under Doe, these inconsistencies mean that there are now significant holes for all protections in the anti-discrimination framework within state law. HB 602 is a fantastic bill that plugs one hole created by Doe, but Marylanders are currently without state-level legal protections for many other forms of discrimination. Absent a comprehensive solution, any current or future piecemeal attempts to remedy Doe, like this bill, will only perpetuate the problem of incomplete anti-discrimination language that Doe created. We support the concept behind HB 602, but we urge this committee to think big about how it responds to the case. HB 602 remedies one important gap, but again, we urge the committee to consider amending the bill in a way that standardizes all anti-discrimination clauses within state law to comprehensively ensure that all people in every traditionally protected category are not subject to discrimination based on protected characteristics in any context. Thank you.
Thank you. I have a question. Did you submit the same testimony in the House
I did, yes.
and the bill was not amended?
The bill was not,
Was
no,
not
this
amended.
bill was not amended, no.
Thank you. Do you have any other questions for this witness? Thank you very much for your testimony.
Thank you.
That will end the hearing on House Bill 602. I need to leave and go to the House and present some bills. So my Vice Chair, Senator Klausmeyer, will take over the meeting now. Thank you.
So just, okay, I want to see who's here and who's not here and. Is Delegate Jesse Pippy here? Okay. House Bill 149,
Should you have a preference for podium or
so you can either stand or sit, it's up to you.
All right, Madam Vice Chair, committee members, Delegate Pippy, for the record here in support of HB 149. So this bill deals with medical records. Long story short, we had a constituent that came to us who was a victim of abuse. And what ended up occurring was the victim went back to the medical provider to get some record to corroborate her story and found that the medical records had been disposed of. And so what we looked into is that in Maryland, after 5 years, or if you're a minor, 3 years after the age of majority, a medical provider can actually dispose of records. Further looking into this, we found that Maryland's law was not compliant with federal law. Federal law requires 6 years. And so even to more point is a couple of years ago, we passed the Child Victims Act of 2023, in which individuals that were victims of abuse had an opportunity to look back. Well, when they go back to get their medical records, they're all gone. And so what we've done in this bill is we found a compromise. So we want to update the medical records provision in state law to 7 years, because right now we're actually tied for the worst laws in the United States, the worst in the United States, not even compliant with federal law. So this would bring it up to 7 years, and then 7 years if you're a minor, once you reach the age of majority. We worked with the HEO committee, MedChi, and all the medical stakeholders for this compromise. Another thing I wanted to point out is you remember physician Larry Nassar. So there have been states across the country that have been updating these records, the record retention policies, for all the reasons mentioned. The last thing I want to say is this. In Frederick County, we had a doctor, Dr. Ernesto Torres, who actually for 40 years predominantly provided medical services for the Hispanic and Latino community and was actually abusing children for 40 years. And it was just shocking. And so when finally victims had the bravery, to come forward, it was in the newspaper, he was actually found guilty. By the time victims went back to his practice to retrieve their records, they were all gone. And so this closes an important loophole for child victims. It updates the law to be compliant with federal law. It's a bipartisan bill, unanimous support in the House, and I would hope that this committee would support it. Thank you, Madam Vice Chair.
Yeah, I just have a couple questions. The Department of Health has given an amendment. Are you aware of that?
So we just saw that. I don't think we saw that on the House side. So they're asking to change one word from and to or, and they're also wanting to bring back the newspaper. So I think you have a medical physician here on the panel. There's a requirement now where you'd have to post in the newspaper if a physician's office goes out of business and they say, hey, we're closing. I mean, it's 2024. I'm not opposed to that amendment if it's the will of this committee, but we changed it to where you can provide notice via email and some more 2024 type methods of communication, but we did see that. Yes, ma'am.
Okay, all right, thank you.
Thank you.
Are there any other questions? Hearing none, thank you very much.
Thank you.
And enjoy your day. House Bill 567, Delegate Love, are you here? Here she is.
Good afternoon, Madam Chair, members of the committee who are left. Wow, I hope that wasn't me. Everybody just got up and left. Goodness gracious. Delegate Sarah Love here to present House Bill 567. We are the cross file of Senator Giles' online privacy bill. Thank you all so very, very much for all of your hard work on that bill and passing that bill. There are a few differences between the two bills, but I trust those can get worked out without too much trouble. And I'm here for any questions. I ask for a favorable report.
Thank you. Are there any questions?
Madam Vice Chair, I don't have a question. I just have a quick comment on Delegate Love and I worked really hard along with Patrick on I know there's some differences between the two bills, but I mean, the behemoth that was this bill. And I just really was very grateful for her partnership on getting this very important bill almost to the finish line. So thank you, Delegate Love.
Thank you,
Madam Vice
Senator
Chair.
Gile.
Okay, thank you.
Thank
No
you.
other questions? Okay, we're gonna move on to House Bill 676. Enjoy your day. Delegate Love. House Bill 676.
Sorry, couldn't hear you, Madam Chair.
Okay,
So good to be in front of Senate Finance and all my friends over here. Good to see you guys, Madam Chair. This is House Bill 676, the right to try for individual patients and treatment options. Back in 2017, the Senate passed the Right to Try Act. It was unanimous in the House and the Senate. And then in 2018, they signed it into federal law. And this legislation adds to make some slight changes to that. As you know, there's 7,000 rare diseases that have been recorded, affects 30 million people. And the major breakthroughs that we've experienced in the medical community have really been from individual medicines and individual treatments based on your genetic code. These drugs are tailored to you. And I had some, not really an apples and apples comparison, but close enough with my father. About 6 years ago, he was diagnosed with stage 4 melanoma. And if you ever had stage 4 melanoma, that used to be a death sentence. Traditional treatments options for his condition, I think he had a 15% chance at a 2-year life expectancy. And they put him on this drug called Keytruda. It was just approved by the FDA. He was one of the first people that were on it. And it was amazing. Didn't have any of the side effects. It was immunotherapy. He took the medication every 3 weeks intravenously. And it's $8,000 a dose. Thank God that Medicare Part D ended up picking up 90% of that. But didn't have any of the side effects that you would think from chemo or radiation. And what really got me is I went with him to the doctor he was in this for about 3 months. And he took his shirt off and the doctor's like, he's like, you feel okay? He's like, yeah, well, I have this rash. And the doctor's like, well, this is a demasking drug. Your body would fight the cancer if it knew it was there. These red dots on it looked like somebody took a Sharpie and went over them. Because that's basal cells. The drugs are fighting the other cancer that you didn't know you had. just amazing stuff. So after 10 months of treatment, he's completely fine, cancer-free. He's been cancer-free for 5 years. We're in the middle of the golden age of oncology. And that's why I think this law needs to be updated to give people that are finding these life-debilitating diseases or that might have a terminal disease and outcome, a fighting chance and some hope. Now, I will say that we put some safeguards into the bill as far as informed consent. 2 doctors have to have their approval before any treatment. But the main safeguard that's in the legislation, if you look, it has to be in a federal wide assured facility, which is a pretty big deal because that's the federal regulations for all human experimental medication. So that safeguards in the bill. So the one complaint I have heard from people is that they're concerned about medical exportation, and that should satisfy anybody's worried that there's not 2 guys in a garage in Mexico that you're going to. This actually has to deal with real facilities like Hopkins or University of Maryland. So with that, I'd be happy to answer any questions.
I just have a question. How did your father, and you may have said it and I missed it, but how did your father find out about the drug? Did the doctor say it?
So exactly. So
Or
when I
how
said it
would
wasn't
one
a-
find?
yeah, so when I said it wasn't an apples to apples comparison, the difference with my father and with this legislation is the drug that they did put him on was FDA approved. It was just recently. I don't believe it was FDA approved until 2016. So this legislation would allow for drugs that weren't FDA approved that are not in clinical 1 trials. The right to try, the original federal legislation requires an FDA trial. The problem is that if you're looking for medication designed for you, this medication is made for you based on your genetic code, they'll never pass FDA trials because there's not enough people for the trial.
Right.
My dad was lucky enough to find out because he got a really good oncologist. He was
Okay.
over at the Melanoma Center in Virginia. And it's, because you get diagnosed like this, you start Google searching stuff, and that's a bad deal. But, I'll tell you, I had a little healthcare scare myself this summer. And legislation like this, I think, is really meaningful. Even if it doesn't apply to you now, because one day you might.
I hope by the time you need it, it'll be passé. It'll be outdated.
That's what I'm
anyway.
hoping for.
So anyway, Senator Reedy.
Thank you, Madam Vice Chair, Delegate Morgan. This is, I think, a really good bill with making adjustments to right to try, which is something that has really broad support across like everybody. There was an info letter from the Attorney General's office. Did they register this letter in the House?
So they kind of. So they registered a letter in the House of some concern, and it looked like the original letter was written from a venture capital firm. That's what they actually cited. That I was like, this letter comes from a venture capital firm that actually had a financial interest in pharmaceutical companies. I've met with the OAG's office over this. I thought we had him satisfied with some amendments we made to the bill as far as the informed consent. And then they released that letter last night, so I haven't had a chance to address it. I will say that
if I could interject, just because there's a point of the letter, they're talking about because your bill says that folks have to consider all treatment options, but then you have an informed consent component, right? So
the informed consent is, they have to draft it. It's from the OAG office. That's where the informed consent comes from. And look, any federal wide assured facility would also have informed consent. Now, I'm just shocked that the AOG's office, everything seems to be centered around, they can't believe a patient would try something that wasn't FDA approved. But again, this is going through the HHS side of treatment options. It comes in a federal wide assured facility. And look, if the patient is informed and this is their only option, I think it's almost immoral for the government to stand in the way and, stand in the, just having some hope that they, you might be able to get better or recover from this.
Yeah. That's good. Yep. Thank you
Oh,
very much.
one thing I did forget to mention, this legislation has already been passed in Nevada, Arizona, and looks like it's going to be passed in Iowa and California as well.
Okay, thank you. Senator Kramer.
Thank you, Madam Chair. Delegate Morgan, outstanding bill.
Thank
The
you.
merits are on its face, very apparent, and thank you for bringing this bill to committee. Appreciate that.
I appreciate it. Thank you.
Anybody else? No other questions? Well, thank you
Thank you,
very
Madam
much.
Chair. I'll let you
Very
interview the rest of the
very
HDN committee.
informative.
Sure.
Very
Thank you all so much.
informative.
See you guys.
Okay, Delegate Tiffany Alston.
Good afternoon, Madam Chair and members of the Senate Finance Committee. I am Tiffany Alston, delegate from District 24, here today to ask for your favorable report on House Bill 829. This bill will provide for mental health awareness and skills building training to service sector employees. The reason I did this bill, I have a staff member that spent her career doing mental health training. She went and saw a New York model where cab drivers had actually been trained by the Department of Health to recognize mental health disorders and refer people if they needed assistance. It was also done with bartenders. And I thought with the mental health care crisis that we're in right now, wouldn't it be great if people who were interacting with folks on a regular daily basis were able to identify and understand a little more about the mental health crisis that they may be seeing. So instead of calling the police, they could either call for a crisis intervention team or just give the person a referral. And so what this bill does is it asks the health department to put together a mental health awareness and skills building training that they would then make available to service sector employees. So it could be your cashiers, your taxi drivers, whatever service sector employees that they would want to open it to. There is no mandate in the bill. It would be completely voluntary for the employees to participate. And I think it's a good thing for us to do, given where we are post-COVID and the vast amount of mental health crises that we're seeing either in our schools or in our communities. This bill passed the House unanimously, and it also passed our committee unanimously. And therefore, I would ask for your favorable report. Happy to answer any questions.
Any questions from the committee? Seeing none? I thank you very much. Sounds like a good program.
Thank you.
Thank you. Next we have Delegate Harry Bhandari. House Bill 959.
Thank you. For the record, my name is Delegate Bhandari. I'm here to present House Bill 959. Chair and my senator and members of the committee. This bill aims to update and refine the continuing education mandate for certified dialysis technician, ensuring they have access to a broad range of educational opportunities essential for their professional development and patient safety. By adjusting the requirement to a total of 3 hours of continuing education without specifying a single course, which is not available, we enable the CDTs to participate in a wider range of educational activities, and this amendment facilitates the inclusion of seminars, self-study courses, providing them with more accessible and flexible options to fulfill their continuing education needs. And such an approach not only help in compliance with certification renewal requirements, but also guarantees that they're up to date with the latest developments, technologies, and best practices in dialysis care, supporting their ongoing professional growth. And I urge the committee to favorably consider House Bill 959, recognizing its significance in bridging the current gap in educational requirement and enhancing the quality of dialysis care. Maryland Board of Nursing and DaVita, they're in support. There is no opposition. It's a very bipartisan bill passed unanimously from the committee and the House. Any question?
Any questions from the committee? No, seeing none, thank you.
Thank you.
Thank you. And while I just have this little break, I have two of my friends came in and they wanted to sit and have a chat in the office, but it couldn't happen because of time. But this is Leah and Sam Newhouser, newlyweds, right? How long? Just under a year. So thank you for coming, and I'm sorry we can't spend any time together, but enjoy. This is riveting stuff going on here right now, so. Okay, so next we have House Bill 996, Delegate Jennifer White Holland.
Yes, and Madam Chair, I'd like my my fellow to testify on my behalf.
Okay, your fellow.
I'm just here for
Okay,
questions.
that's fine. I do have that here, so that's fine. Just state your name and let it go.
Good afternoon, Madam Chair and members of the Senate Finance Committee. For the record, my name is Glenda Dora Dulce, and I am testifying on the behalf of Delegate Jennifer White Holland. Thank you for the opportunity to present House Bill 996 for your consideration. House Bill 996 would change the name of Consumer Counsel to the Consumer Protection Commission and a division of Consumer Protection in the Office of the Attorney General. As such, the 9 members who are appointed to serve would be considered commissioners. The Commissioner Council is responsible for advising the Division of Consumer Protection and serves as a voice for consumers, businesses, and the greater public. The request to change the name was discussed at previous Consumer Council meetings. As such, the Council and the Office of the Attorney General is aware and in support of the name change. Given the important work that they do, changing the name will better enable them to communicate, educate, and engage Marylanders about the work they do and be seen as a resource. I consulted with the Office of Attorney General early in the process, which led to the bill's current posture. The House Economic Matters Committee voted unanimously favorable with amendments. On the third reading, the House voted favorably, 135 to 1. Because this bill was a last-minute request, the sponsor was unable to secure a Senate cross-file. Fortunately, everything has worked out. As such, I respectfully request a favorable report. Thank you.
Okay. Very good. Do we have any questions? See, you did such a great job. There's not one question there for you. Thank you.
Thank you, Madam Chair.
Delegate, do you have anything to say?
No, just thank you so much. And again, looking forward to our ongoing work together.
Okay,
We have
thank you.
voting in HGO, so I'm gonna
Okay.
get back.
All right, thank you. Delegate Jamila Woods, House Bill 1078.
Good afternoon, Vice Chair Klausmeyer and members of this illustrious committee. I am Delegate Jamila Woods, District 26 for the record. I'm here to request your favorable response for House Bill 1078, Maryland Medical Assistance Program, remote ultrasound procedures and remote fetal non-stress tests. I'm excited that this passed unanimously in the House and was passed over. Remote ultrasound procedures and remote fetal non-stress tests provide vital support resulting from technological advances designed to improve access to maternal health care. Many women who strive to obtain appropriate prenatal care experience numerous barriers, including difficulty obtaining time off from work, lack of reliable transportation, inability to obtain childcare for other children, and also existing medically challenging pregnancies where increased movement of that mother and or the unborn child can have adverse impacts. This bill provides doctors with more options to ensure prenatal care for those who are unable to make routine ultrasound and or non-stress test appointments in person. Teleobstetric technologies approved by the FDA have enabled new and innovative technologies to improve access to maternal health care, including teleultrasound and remote fetal non-stress tests, and ultimately expanding access to these pertinent service provisions. Madam Vice Chair and fellow committee members, the reality of this, Maryland has room to improve as it relates to our maternal health outcomes. This bill would make a significant opportunity for mothers to have better outcomes. And so just to give you quick, how do we pay for this? We pay for it by using the same CPT codes that currently exist. Code number 59025, does not create any new coverage requirements. It simply clarifies how physicians can bill. So in other words, the doctor would be able to bill whether the person was in the office or whether the work was done remotely using the exact same code. So there would not be any difference in a financial impact as a result. With that, I'm going to just ask you request a favorable response, and I'm happy to answer any questions.
Are there any questions? Seeing none, you're finished that bill, and now we'll move on to House Bill 1105 by Delegate Woods.
Thank you. Again, Delegate Woods. Good afternoon, Vice Chair Klausmeyer, members of this Senate Judiciary Committee, Senate Finance Committee, my apologies. I'm asking you for a favorable response for H Bill 1105, Advanced Practice Registered Nurses, Certification Requirements and Exceptions. Advanced Practice Registered Nurses, or APRNs, are at the forefront of delivering preventative care and ongoing healthcare services to residents of Maryland. Their work is further enhanced when nursing students who have met specific requirements are permitted to commence practice through clinical rotations under the appropriate clinical supervision and an agreement with guidelines established by the Board of Nursing. To demonstrate his commitment to leave no one behind and to reduce the shortage of nurses in Maryland, our esteemed Governor Wes Moore increased funding for nursing by $5.8 million last year. Advanced practice registered nurses include nurse practitioners, certified nurse midwives, certified registered nurse anesthetists, clinical nurse specialists, and nurse psychotherapists, all of whom benefit tremendously from this increased funding. But I want you to know these provisions are ineffective if inappropriate beneficiaries of the financial provisions are restricted from fine-tuning their skills during the urgency of now. Again, as in the last bill, we know that we have a great need for increased nursing support. This bill will give greater outcomes, particularly for students who are practicing, just as we have in the social work field. I'm a licensed social worker. In the medical field, where we have interns who serve as students, we have social workers who serve as students and who are able to walk and begin to practice in their fields. We're asking for the same thing for for nurses, so that those students who have met all of the clinical requirements and testing are able to begin working in their field under the appropriate supervision. And for that reason, I'm also asking for a favorable response for this bill.
Are there any questions? Senator Ellis?
Yeah. Thank you, Madam Chair. And thank you for this great bill, Delegate Woods. You mentioned the governor increased funding for nurses. So where is that money targeted? Is it salaries or programs?
I can't answer that specifically. I'd be happy to give you, I don't want to tell you something and not be completely accurate, but yes, it would go toward salary. Yes, it would go toward putting additional nurses in the field, but I'd be happy to get back to you with a more specific response.
I'm just curious about that. Thank you so much.
My pleasure. Thank you.
Thank you, Madam Chair.
Any other questions? Okay, thank you very much.
Thank you all. Have a good day.
And now we are going to go to House Bill 183. And it's Secretary Rafael Lopez. Is he here? And you may take as much time as you would like.
I think I'll go for 2 hours just for fun.
That's fine. That's fine.
No, I'm
That's the
kidding.
deal.
Kidding. Yeah, exactly. Senator Reed's like, we've had enough of that already. Let me just grab the right, we're in the middle of testifying on 3 bills, so I want to make sure I got the right one in front of me. That's right, that's right. Good afternoon, Chair and members of the committee. My name is Rafael Lopez, and I serve as the Secretary of the Department of Human Services. We are driven by 12 core values that represent the Moore Miller administration values, and among these is being innovative. This is a value that has underscored our approach to HB 183. With your partnership, 500,000 children in Maryland will be fed every summer when they're not in school. We will leverage $69 million in federal funds per year to do it, no longer leaving federal dollars on the table for which Marylanders are eligible. Together, we will help families feed their children in every single jurisdiction across Maryland beginning in June of this year. When the state Summer SNAP program launched in 2019, we served 3,923 children in 4 jurisdictions. During the summer of 2023, we served 90,571 children in 14 jurisdictions. The reason not all jurisdictions opted into Summer SNAP is due to a lack of funds and barriers in the opt-in process. By innovatively and seamlessly implementing the new federal summer EBT program, We will help feed 500,000 children across Maryland in every single one of its 24 jurisdictions. DHS is currently required by state law to distribute summer food benefits on different schedule than the disbursement of federal funds. This doesn't make sense as we try to make things simple and seamless for the children and families we serve. It shouldn't be the burden of Marylanders to navigate government bureaucracy to figure out how to get the help they need. It's on us to make it simple and seamless for them. HB 183 will integrate the state summer SNAP program with the federal summer EBT program, which will enable Maryland to feed 500,000 children. We will provide benefits to all children eligible for free and price-reduced school meals, including those not currently enrolled in SNAP. Based on our work issuing PEBT benefits, approximately 60% of the children receiving school meals are not enrolled in SNAP. Federal funds will cover all of the cost of food benefits and half of the administrative costs. By investing $9 million in state general funds for our share of program administration, Maryland will receive from the federal government $9 million for administrative costs and $60 million for food benefits. This investment is proposed in Governor Moore's budget as a $78 million investment in the children and families of Maryland. Responsibly investing $9 million to leverage $69 million innovatively leverages benefits for which Marylanders are eligible. Feeding 5 times more children during the summer for a total of 500,000 children in every single jurisdiction, eliminating inefficient funding coordination with local jurisdictions that's proven to be a barrier for many years, and making it seamless for families simply makes sense. We are fully aware that ending childhood poverty in Maryland does not and will not happen overnight. And that shouldn't stop us from seeking creative solutions that are innovative to make sure every single lever we help pull serves children and families. We would like to clarify that HB 183 also contains technical amendments to the statutes that govern our Human Services Career Pilot Program. These additions to our bill are meant to strengthen our ability to implement the program. We work with members of the House to draft these amendments, and we urge your favorable consideration of this bill and our amendments. Thank you for your consideration. I'm happy to answer any questions.
Are there any questions from the committee? I'm interested in the pilot program. And when does that go into effect?
It's in effect now. I'm sorry. The pilot for the benefits or for the other piece?
The scholarship.
Certainly, it's in effect now. And one of the things we've been doing is actually trying to streamline it. We've discovered contradictory language in the actual bill itself, and so we wanted to straighten that out and make sure we could get more people participating in the program.
Okay, thank you.
Certainly.
Any other questions? If not, we have one virtual, Tamlin Kelly.
Yes, hi. Can you hear me okay?
Okay. Yes.
Okay.
We can't see you, but we can hear you.
Okay, I'm not sure why. I do have my video on.
Okay, you can start just by talking.
Okay, I apologize if that
I mean,
it's
I'm
on my
sorry
end.
we can't see you, but you're loud enough. We can all hear you.
Wonderful. Okay, thank you, Vice Chair, members of the Senate Finance Committee. My name is Tamlin Kelly. I'm a licensed social worker and chair of the Advocacy Committee for the Student Support Network, which is a nonprofit in Baltimore County. We strongly support Summer SNAP for children because it is effective and efficient at both reducing child poverty and food insecurity. These are two of the key barriers that we must address to achieve our mission, that all children have the resources they need to be successful in school and in life. I'm here today to urge you to please consider Delegate Queen's amendments to this bill so that the important program can continue. When first introduced, this bill increased state funding levels. However, it has since been heavily amended and now will completely defund the program, even the modest $200,000 mandated appropriation that was required in the statute. We are especially concerned about families with young children not yet enrolled in school. If the bill passes in its current form, these young children will be left without any food support this summer. That's because the new federal program, Summer EBT, will support school-age children, but young children are not eligible. Children ages 0 to 19 are eligible for Summer SNAP for children, but only if the program continues to be funded by the state. Again, the bill in its current form completely defunds Summer Snack for Children, a program that has supported more than 100,000 children with nearly $10 million in direct support from the state and counties. We know that reliable access to healthy food is essential for all children. It's especially critical when children are very young and experiencing periods of rapid growth and development. Children living in poverty during the first 5 years of life are significantly less likely to achieve measures of school readiness. So supporting these young Marylanders makes sense on many levels. I urge you to support the amendments which will restore the $200,000 state appropriation. And it will also make, I'm almost done, I apologize. It'll also make small changes to the program to allow it to complement the summer EBT program that the secretary spoke about. In this way, both young children and school-aged children will be supported, especially given the high cost of living, inflation, high food prices. We desperately need your support.
Okay, thank you very much. Any questions? Seeing none, thank you very much for your testimony and have a wonderful afternoon.
Thank you.
Okay, now we are going to House Bill 1128 and Labor and Employment. And we have Secretary Porta Wu to testify.
Thank you, Madam Chair and members of the committee. For the record, I'm Portia Wu, Secretary of the Maryland Department of Labor. It's my pleasure to introduce HB 1128, a departmental bill to establish the Maryland Talent Innovation Program and Fund. I'm joined today by Rachel Stevens Parker, who's the Executive Director of the Governor's Workforce Development Board, to help answer any questions. Workforce is at the center of economic competitiveness. A recent survey of Chamber of Commerce executives found that workforce was the #1 issue businesses consider when deciding where to locate. But unfortunately, in Maryland, our labor force participation, which used to be among the top in the nation, has not recovered post-pandemic. We have had the largest labor force participation drop of any state since 2020. Maryland is competing with our neighboring states for talent and for employers, and to win, we have to supercharge our workforce pipeline. We also know that we have tough budget choices to make. That's why the department has proposed this legislation with an innovative approach to workforce development financing. It creates a talent innovation fund, which would provide a vehicle for foundations and the private sector to co-invest with us in creating more opportunities for residents and meeting the talent needs of employers. This provides more flexibility than federal workforce dollars and makes state funding stretch further. The fund would support workforce in key industries for Maryland, including cybersecurity, healthcare, biomanufacturing, and AI. Cybersecurity is a good example of an area that's a strength for our state, and we cannot and should not be ceding this ground to neighboring states just because we failed to connect the dots. There are thousands of unfilled cybersecurity jobs in Maryland, and that demand is only projected to grow. What's more, the field presents many opportunities for individuals to gain credentials and good jobs without a four-year degree. The legislation thus proposes that the Talent Innovations Fund initial pilot focus on cyber ranges, a recognized method for developing work-ready cyber talent. This investment can be used to support additional cohorts of learners beyond the proposed pilot phase. We do have proposed technical amendments. First, to clarify that local workforce development boards are among the eligible awardees, and second, to revise language so as to not confuse or overly narrow the intent of the Talent Innovation Fund. Finally, I want to note that the governor's budget reflects $2 million to invest in the Talent Innovation Fund, an investment that the Senate budget bill supported. But we want to underscore that regardless of whether there is money appropriated in this year's budget, it's still very helpful to have the language establishing the existence of the fund and program so we can accept other contributions to support this work. Thank you for your time and attention. I ask the committee for a favorable report on HB 1128 with the technical amendments proposed, and we're happy to take any questions.
Thank you. Any questions for the secretary? Senator Hayes?
Thank you, Madam Chair. Thank you, Madam Secretary, for the presentation. I did notice that two of the categories that would be covered would be the biotechnology as well as the artificial intelligence. And as you know, the Baltimore region just was awarded the Tech Hub. Is it your intention to merge the efforts with this innovation to the efforts that's going on with the Biotech Hub? And how has the Department of Labor been involved with that effort?
Absolutely. Well, I think the idea is those are examples of emerging industries where we'd like to be supportive. Obviously, we hope very much that we will be awarded additional funds with Baltimore Tech Hub. We worked closely with the applicants to suggest language, and we're very familiar with some of the occupations they're looking at, some of the training pathways. And I think we see this as another opportunity to either leverage state funds, maybe draw funds that are not federal funds to be supportive of that effort. But we know there were very specific matching requirements and commitments that were made around that grant. And we don't see that our work is conflicting with that. We'd only want to be complementary.
Right. And practically, how do you see the funds here being used? Is it to partner with community-based organizations, nonprofits, or is that to essentially pay for state employees within the department? How do you see?
Oh, I see the question. Oh, the idea is to have innovative financing mechanisms for training partnerships, but also, for example, certain kinds of federal funds often have restrictions on who you can serve, how you can serve them. They may say you can only do it for, they really want you to focus on training, but they don't want you to do capital investments, say for training equipment, which in some of these cutting edge fields, that's necessary. Cyber ranges are a good idea. There have been partnerships, for example, with community colleges focusing on this, but sometimes it needs an upfront investment. So I think the idea is we would look at that. There are different ways of funding training too. That's not just sort of, let me pay for this. Maybe we can do that in partnership with other groups as well. So I think the idea is it could be a variety of approaches, and we want to be a little bit more flexible so we can test things out.
Excellent. Thank you for your answers. Thank you, Madam Chair.
Are there any other questions? But I have a quick question. Are we still utilizing the EARN program?
The department does still have the EARN program, and I will say our solicitations, this next round of funding just closed on Friday, and we had record interest in that program. So we do have, and the governor's budget recommended a $2 million increase to that program as well. So
what is it? You have 2 million and plus what else? I mean, how high was it?
So it was in addition to the existing budget, which I want to say is 10, Rachel, do you remember? The increase was 2 million in the governor's budget, which the Senate also supported. This would be a separate 2 million in the Talent Innovation Fund. Part of the reason is EARN has a very specific structure under the statute. You have to have 5 industry partners. It needs to go for certain purposes. And we love the EARN program. We hear from employers and industry all the time what an important, vital program this is. And the fact that we had more demand than ever this year, frankly, far exceeding what we could fund, shows, I think, how popular it is with employers. But that said, we recognize maybe you're a newer industry, maybe you don't have 5 industry sector partners in your area, or maybe there's a need for more of a capital investment or a different model of funding than EARN would traditionally follow. So that's why we suggest the Innovation Fund. It's an additional tool. Just like when you're building a house, you can't use a hammer for everything. You want to have a screwdriver, you want to have other tools. We see it as another tool in the toolbox.
All right. Thank you very much.
Thank you.
Thank you. Any other questions? All right. And next we have Rachel Parker.
That was me.
Oh, so you're not,
I was just.
you're just there for information. Okay, thanks, Rachel. And then we have John Fiastro.
Good afternoon, Madam Vice Chair, members of the committee. For the record, my name is John Fiastro, here on behalf of my client, the Cybersecurity Association of Maryland. The Cybersecurity Association of Maryland counts over 600 members, from owner operators up to Fortune 500 companies. And the association supports House Bill 1128, particularly because it seeks to address workforce needs in a variety of industries, but particularly cybersecurity. The Secretary mentioned it, and we'll highlight that the bill calls for a pilot in the innovation program for cybersecurity. We are excited about that pilot and how it will support cyber ranges. And for this committee's benefit, cyber ranges are a very integral part in training in cybersecurity. applicants within the industry acquire skills in that closed cyber range in a way that they cannot do. You think about cyber range as a closed place where you can experiment with viruses, if you will, or other cyber pieces that you can't do out in the open, connected to the internet. So because of that, it addresses a shortcoming within the industry. We look forward to filling the 31,000 openings in cybersecurity here within the state, and with programs like this, we hope to do so. So with that, Madam Chair, we ask for a favorable report on HB 1128.
Okay, thank you. We have any questions? Okay,
Thank
thank you
you.
very much. You have a nice afternoon. Okay, next we have House Bill 1053, State Board of Nursing Executive Director Qualifications with Delegate Ann Kaiser.
Thank you, Madam Chair. Good to see you all today, and thank you.
And take your time, okay? You're not on a time limit or anything.
As per my colleague behind me, Delegate Lewis, we were able to vote, and for all of you who are in our committee in the last 3 days, we just voted out all the identical cross files. We did about 4 pages of bills in 15 minutes, and knowing we'd have to run here across the street. So thank you for waiting and skipping our bills. Again, thank you all. I'm here on support of House Bill 1053, and it's about the State Board of Nursing and the Executive Director qualifications. And you have my written testimony. I'll just cut to the chase of what we did here. Was we're simply requiring that the Board of Nursing, as with the 4 other major health boards, that they don't have to have an executive director with a nursing background. What's interesting, however, is that we're leaving it to the board to appoint that person. So they could still on their own decide that they want to nurse. I would there's a backstory, and I can tell you some of the reasons why if you care, and give you more of that. But I would just say, if there was someone who had been a nurse and was still working in the public health profession and had a great administrative executive background, that might be just the person the board would want to hire, and they currently wouldn't be allowed to. So just trying to give some of that flexibility. Just quickly add, it's certainly not a reflection on the current executive director or past executive directors. This passed unanimously in the House. And so I urge your consideration. Thank you.
Are there any questions? Okay. Senator Ellis?
Yeah, thank you, Madam Chair. Thank you for this bill. I see the Kaiser, the Board of nurses don't like this, Nursing Association. And I know in a lot of professions, to be in that profession, you need to be a head, or you need to be a professional. So like, say, for judges, they have to be lawyers
Not if you're on the Supreme Court, however.
Thank you for that. Supreme Court of Maryland or US?
US.
US, but how about Supreme Court of Maryland? They have to be.
Actually, I'm not sure.
Okay, but US Supreme Court, yes. So even like for Attorney General, it has to be an attorney, a lot of judges, and so on. So nursing is a very intricate field, a lot of specialists in there, and so I'm wondering why this would work.
Sure. Yeah. Sure. Thank you. Thank you for that question. The Board of Physicians, the other major health boards, do not require that. There had been and this is in my written testimony referencing an Ernst & Young study, as well as one by our DLS Office of Program Evaluation and Government Accountability, where they had an array of recommendations, many of which came through last year, I think, from bills that were offered by Delegate and Senator Kelly. I think she was her own cross file on this bill. But they had an outstanding recommendation that the board executive director not be an RN. And so while it doesn't align necessarily with other boards of nursing across the country, it aligns with other boards here in the state of Maryland. But because we're leaving the authority to the board themselves, they still can decide to require this. But I'll go back to the example that I provided, that someone who was an active practicing nurse has stayed within the public health field, so they're still knowledgeable of nursing occupation and hospitals and other such things, but has other executive experience. the board would currently not be able to hire someone like that. So this is just about flexibility.
Okay, I
So,
got it. So someone who maybe served as a nurse, but move outside of the profession, then keep their license up. They, okay, got
Yeah,
it.
someone like that
Yeah.
would be an option.
Yeah, thank you. Appreciate that answer. Thank you, ma'am.
Okay, any other questions? With that, I should have just asked Secretary Herrera Scott just to be up there with you. Here she is. You could have been. Thank you.
Good afternoon, Chair, members of the committee. I think you heard the testimony for all the reasons that were just stated. We are in support of this bill, not only because two independent evaluations came to the same conclusion, but as was already stated, there's a precedent. I can tell you I'm a physician, and years ago when I was at the Deputy Secretary of Public Health at the Health Department, I hired Christine Farley, who is not a physician, because I was looking for an executive that could lead a team, that could manage a budget, that could do customer service because of the number of nurses and nursing assistants and licensees that they take care of. I was looking for other features in the leadership of the board. And because you have enough expertise in the number of nurses that actually work in the board, plus your board that works with the executive director is mostly comprised of nursing, there was enough subject matter expertise to support. So we are in favor and respectfully request a favorable vote on this bill.
Okay, any questions for the secretary? Okay, thank you very much. And now the next panel, we have for the unfavorables, we have Robin Elliott and Catherine Ling. Hey, Robin, you want to go first?
Sure. Good afternoon. Robin Elliott here today on behalf of the Maryland Nurses Association. I first want to thank both the sponsor and the department for really having very frequent and thorough discussions with us. We are just at a difference of opinion, as you will hear. There are about 3/4 of the boards of nursing in other states are headed by a nurse as the executive director. And also you heard from us last year with Delegate Kelly and Senator Kelly's bill on that made some changes to the boards. This was one of our requests, is that the Board of Nursing's executive director remain an RN. And so we are being very consistent in coming back and asking for that again. Thank you very much. And I think you'll hear from some nurses today.
Hey, thank you, Catherine.
Yes, my name is Catherine Ling. I am here representing the Maryland Nurses Association. I've been in nursing now for way over 30 years. I won't tell you exactly how long. We are requesting that the executive director, as part of the qualifications, remain a nurse. Nurses are not just a nurse. We have nurses that have MBAs, JDs, degrees in informatics. I myself am a nurse scientist and certified in education. So we wear a lot of hats as we go forward. As Robin mentioned, over 70% of the state boards of nursing have an RN in their executive director, and 9 out of 11 members of the National State Boards of Nursing also have an RN background. This is a respectful disagreement. We appreciate, we are all on the same mission for better healthcare for Maryland's, but we come as nurses to this with the knowledge of the various educational on-ramps it takes to be a nurse. There are different levels of nursing that we have out there, from bedside nursing to community health nursing to nursing in different schools. So knowing all of the different on-ramps, all of the different regulations going forward, having that background in nursing is really what sets it apart from some of the other professional boards. We appreciate being part of the discussion and having our voices heard. And as was said, this is a respectful disagreement on point, but an absolute lockstep agreement on providing the best health care possible to Marylanders. Thank you very much.
Are there any questions? Now, I just have a question, and maybe I missed it somewhere, that if they do the study and the report comes back, it doesn't mean you have to be a nurse. You could be an attorney or something, correct? But as it currently stands, it has to be a nurse.
A nurse has to be part of their skill set. Yes, ma'am.
As an executive director.
Yes, ma'am.
Okay, but this bill would say maybe not.
Correct.
Okay.
It opens a door that we as nurses are loath to see open, just from having seen steps forward and steps back. We really want to make sure that we keep that nursing perspective.
Okay, thank you.
Thank you, ma'am.
Any other questions? Okay, we have one virtual, and that is Dr. Christy Waterman.
Yes.
Man.
Can you hear me?
Yes, we're ready.
Okay. All right. Thank you. Good afternoon, everyone. Madam Chair, committee members, I want to thank you for this opportunity to speak before you today. And I echo the sentiments of Robin and my colleague, Catherine, there today, that we're respectfully disagreeing with the requirements that said that is now stating that the executive director of the Board of Nursing does not need to necessarily be a nurse. I'm a duly certified family nurse practitioner and psychiatric mental health nurse practitioner. And I am also the immediate past president of the Maryland Nurses Association. And I am speaking here this evening on behalf of our membership of the Nurses of Maryland, who I have received several calls from stating their concerns in regard to this bill, that there would not be a mandated requirement for a nurse being the executive director of the Board of Nursing. As my colleague stated before, nursing, the profession of nursing, we've worked so hard to get to where we are, and having a nurse at the head of that organization means a lot to the nurses in Maryland. What they have verbalized to me is that they think that this is going to be a step backwards for our profession and for our nurses. So they respectfully requested that Maryland Nurses Association be present at this hearing to state their concerns of not having a nurse. As we all know, we have nurses in all different aspects of nursing and in all different aspects of business, from the bedside to the bedroom, to the boardroom. And we like to continue to see that. So we're asking that you respectfully consider keeping a nurse as the executive director at the Board of Nursing. Thank you for your time.
Thank you very much, Doctor. Are there any questions? Seeing none, we'll move on to the next bill, and you have a nice afternoon.
Thank you.
And House Bill 1434, Department of Human Services, Electronic Benefits Transfer Cards. And we have Delegate Robin Lewis with us today.
Thank you, Madam Chair. Good to see you, esteemed members of the Finance Committee. I'm Delegate Robin Lewis here on behalf of House Bill 1434. This is the Electronic Benefits Transfer Cards Restoration of Benefits legislation that builds on the work that we did last year in the General Assembly to establish the first in the nation stolen benefits replacement program out of the Department of Human Services. Building on that, the bill before you, which is in the posture in which it passed the House, does really one thing. The bill before you makes it clear that this first in the nation wonderful and important program that we established last year is contingent on the availability of funds, and it establishes a work group that will help us forge a dedicated funding stream to make sure that the restoration of stolen benefits continues without interruption. Now, I know you're all busy. It's the week after crossover. I hoped to come before you and just sell you on that high level explanation of what the bill does. but I think you deserve a little bit of a refresher and a little bit of context. The bill before you has been the subject of a lot of energetic and, interactive input from stakeholders. This bill before you has also gotten a fair amount of media attention this session. And it's because of some concern that the bill will undermine the restoration of stolen benefits. I have worked very closely and for many weeks and months, in fact, communicating with stakeholders, those with concerns, opponents, proponents. And I'm here to assure you that the intent of this bill is to keep that vitally important program going. I'll have you know that since we passed last year's bill, the Department of Human Services has restored $22 million in stolen benefits to 33,000 Maryland households who were the victims of fraudulent theft of SNAP and cash benefits. So we are keeping people whole for the first time ever, and we intend to keep doing that. But we need your help to help us forge a dedicated funding stream through the work group this bill proposes to establish. With that, I'll end. I'll let you know that Secretary Rafael Lopez of DHS is here to answer questions if needed, but I'd be happy to take any questions you may have. Thank you, Madam Chair.
Secretary, would you like to come up and sit up there in case anybody, because I do, but in the meantime, Senator Kramer has a question.
Yes, thank you, Madam Chair. Delegate, good to see you, ma'am, and Mr. Secretary, a pleasure to see you again, sir. And I guess, and I want to thank you for all the good work you've been doing on this issue, Secretary. It's very much appreciated and was very much needed. The concern I have is that, as I understand it, with this bill, the funding becomes an option. And I know that there was concern that, are we going to be able to keep federal dollars? Are those federal dollars, going to go away? I guess the question I have, and the bill specifies, subject to the limitation of the state budget, the department shall do the following. Subject, but it's the predecessor here is subject to the limitations of the state budget. And I'm just concerned that that could mean we are not going to be funding these stolen benefits. And it's my understanding it is still happening at quite a pace, and which is disconcerting that we're still having such a large amount stolen. So the two questions I have, the first is, if in fact those federal funds that are part of the equation go away, what will happen to reimbursements? And secondly, is it possible that, I understand, you're trying to get out in front of this, but are we perhaps sort of putting ourselves in a position where maybe we ought to wait and see what happens and then address it legislatively next session? It just seems like we're sort of, let's panic now to avoid the rush later. And can we hold off on doing this till next session and see what happens with the federal funds? So that's kind of the two questions, if you'd be so kind.
Happy to. Delegate,
thank you.
I'd like to say one thing, a little context setting. Thank you for your question, Senator. I'll just mention, all of you are aware of this, but just to center this fact, the language subject to availability of funding, contingent on federal or state funding, that language exists all over the Maryland State Code. It exists under other articles of the state code. It's not uncommon in the health article, for example, with regard to Medicaid. It exists in other places in the health services article. So remember that we figure out a way to fund the programs that we need with that language in place. Thank you, and I'll hand the.
No, and I appreciate that. I truly do, and I know it's not unprecedented. But we just passed a bill last year to take action on this problem, and it does appear with the inclusion of this language that perhaps we are stepping back from that commitment last year and now putting at risk the possibility that those funds might not be there to help some of our most vulnerable populations. Thank you.
So I'm happy to respond, and thank you, Delegate, for your leadership on this bill. Let me make a couple of things very clear on the record, as I've been trying to do repeatedly during the session, which is that this administration, with your partnership, 100% supports the reimbursement of stolen benefits. To be clear, the policy of this state on January 1st of last year was to do absolutely nothing. And with your partnership, we crafted a bill with the leadership of Delegate Lewis and Senator Hester, and we passed in a bipartisan fashion the nation's first program. That wasn't the assignment, but by being the first, we actually had to create from whole cloth a way to do this well, to make it simple and seamless for our families, and to model fiscal prudence and fiscal responsibility. To that end, we used a combination of federal and state resources. And to be clear, 64% of all the funds that were reimbursed this year were federal funds. We now have an answer to your question, Senator, about what will happen if. The appropriations bill recently passed by Congress did not include money for the continuation of the replacement of stolen benefits past September 30th of this year, which was the proposed date of sunset, number one. Number two, we are all live in a federal presidential election year and have no idea what will happen with the agricultural bill, the farm bill as it's known, which specifically funds key pieces from which the state of Maryland draws. So as of October 1, the state of Maryland would be 100% responsible for the replacement of benefits. To your question about whether or not we would move backward, the answer is resoundingly no. However, it also rests in your hands as a General Assembly. The governor has proposed in his budget over $27 million for the reimbursement of stolen benefits in this FY25 budget, which means if the General Assembly passes that allowance based on the governor's recommendation, we will actually have planned prudently and fiscally responsible for the potential sunset of federal government funds. So we are both running an existing train that says we will reimburse benefits, number one. Number two, we would love if the federal government will continue to partner with us to join us in reimbursing benefits. And if not, the state of Maryland is still leading nationally by making sure that we have a prudent budget to respond to the continued theft. So that's in direct answer to your question. On the issue of reducing the continued theft, we are equally concerned with everyone in the General Assembly about what has happened. But as we've tried to articulate, it is not a state of Maryland problem alone. It is a national problem. We have worked closely with Maryland's federal delegation to encourage them to encourage their colleagues in Congress to allow for further investment of federal funds to help us reduce the continued theft of benefits. We have yet again been the first state in the nation to model more practical ways to reduce the theft, everything from card lock and unlock features, looking at changing pins. We just, we're in the last weeks of reviewing the first ever Maryland RFP to introduce chip card technology, which exists on all of our bank cards, and unfortunately does not exist on this Independence card. The point of all these things are we cannot act fast enough to continue to reduce the theft, but need the federal government to be our partner. So in conclusion, I simply want to say again, we absolutely intend to continue reimbursing stolen benefits. And to the delegate's point, the federal government's language on SNAP and TANF, which are two federal sources that make up the bulk of our department's budget, also include language that is based on the appropriation of funds by Congress. We are modeling that kind of language here and do not intend to go backward in time.
And thank you. I appreciate all of that. I guess I'm still not sure, and because there was a lot there, just on the issue of federal funds and the potential expiration of those funds. When is that potential?
So
Is it not late this year, late in the fall, or?
That's correct, sir. So September 30th, 2024 was the language included in the original bill that was signed by President Biden. So we are anticipating the conclusion of the federal contribution as of September 30th. All of us, advocates, delegates, families alike, were waiting for some signal from the federal government that they would place in the appropriations bill more money. I think it was 6-7 days ago. That answer is now clear. They put in zero.
No, understood. I'm just trying to get, and so just to try to stay on point with all due respect.
Understood.
Can we not wait until next session after that has happened, rather than change the statute now? And I appreciate that the governor is committed. He's not going to always be the governor of this state.
Understood.
As we found in the prior administration, there was an unwillingness to do anything to address the problem. Flat out unwillingness. Going forward, once we have changed this bill, the last year's statute, and we incorporate the language that's part of this, we will have enshrined in statute the ability to not actually fund. Is it possible, A, we could wait until next session after we see what the feds do before we take make a significant change to what we just passed last year? That's number one. Number two, you brought up the TANF funds. My understanding is that TANF funds can also be used for this purpose. Is that accurate? And if so, have TANF funds been used for it? My understanding is that there are available TANF funds that have not been used by the state and could in fact be used for this purpose. So is that accurate, an accurate assessment? And if those funds are available, can we utilize them, and why not? And again, can we not wait and see what in fact happens at the federal level before we go down this particular path, and then make that decision instead of enshrining it in statute now?
Certainly. I'll begin with your first question about whether or not one can wait. And with all due respect, sir, that is the job of the General Assembly to make a decision about that, not mine. My job is to advise you and the governor with the best advice and counsel that me and my team have. That best advice and counsel is to be fiscally responsible and to walk you through a series of scenarios to plan accordingly, number one. Number two, Maryland budgets year to year. The governor has proposed in his budget $27+ million to exactly solve this problem for this next year. We will need the partnership of the assembly to concur with the governor on that one or not.
Sure.
So the matter of waiting is not my decision. I'm sitting here at this table in partnership with Delegate Lewis to say to you, you should not wait because we should plan appropriately. Now that's our best advice and counsel to you. Number two, on the issue of the use of TANF funds, the answer quickly is yes, they are possible to use. And yes, we have used some in the replacement of Maryland's stolen benefits. Why? When we sought the advice and counsel of the Office of the Attorney General to make sure that we were looking comprehensively at the replacement of stolen benefits, we did this in a phased approach, phase 1, phase 2, and phase 3. At the end of the day, we did use some TANF reserve dollars to make sure that we could go back retroactively and make sure everyone who is eligible for benefits, the reimbursement, received them. We are almost done. I believe it's like April 20th or something. We'll be done looking at 16,000 cases, and we will have used a portion of TANF funds to do that. So yes, it is possible. Yes, we did it. And yes, we leveraged it to make sure that we maximize every single federal and state dollar. We call that good planning. And that's why we're here today to say to you, we would be not doing our jobs to not advise you of the various scenarios. And at the end of the day, you all have a decision to make about whether or not you want to wait or not.
Thank you.
Certainly.
Nope, very much appreciated. And again, thank you for all the work that was done last year on the issue.
Certainly.
Thank you, Madam
We appreciate
Chair.
your partnership. You were a key member of that effort, and we appreciate your leadership, sir.
If I may, Madam Chair,
What?
add one little.
One quick one.
Yes, ma'am. Thank you. The bill before you includes a proposal to establish a work group that will in fact study and make recommendations so that we can be ready in session 2025 to have a dedicated funding stream. Thank you, Madam Chair.
Any other questions? If not, okay, we will take the next group and
Thank you.
they're the unfavorables. And it's Lisa Klingenmeyer, Mayor, Gloria Brown, Michelle Madio, Lonia Muckle, Callie Schmitz, and Elizabeth Epps. And I'm sorry if I said your names wrong. And we'll start on this end and go right down the line here. And you each have 2 minutes, and it'll be interesting to hear what you have to say.
Starting here.
Okay, right there. Yep, you're first.
Okay. Good afternoon, Madam Vice Chair and members of the committee. My name is Elizabeth Epps, and I am Deputy Director of Maryland Hunger Solutions. We have submitted written testimony in opposition to HB 1434, and I'm grateful for the opportunity this afternoon to speak to you all about why we are opposed to this bill. Maryland Hunger Solutions assists Marylanders seeking food assistance through applying for SNAP. For the past year, we have assisted 100 households directly with submitting claims for stolen benefits, and have heard firsthand how this theft affects their livelihoods and how restoring them in full is absolutely necessary to maintain their family's health and well-being. The challenges this bill would make to a law that's working extraordinarily well, the law that was passed last year, would be devastating to families across the state. If a single mother of 3 in Baltimore County, let's say, experiences theft of her family's benefits in October of this year, when appropriated funds may have run out, she will be left stranded by DHS with no available recourse. Importantly, we believe that this bill will exacerbate food insecurity in our state. EBT theft is still a rampant issue in Maryland and will likely continue at current levels for the foreseeable future due to the slow implementation of security features. Card locking and unlocking is available to Maryland EBT users, but only to those with a smartphone and the knowledge of how to download and use the app Connect EBT. For households that are able to access the app, recent survey data has shown that over 50% have difficulty accessing the locking feature due to technical issues. So this is not a sustainable solution. I'm running out of time, so I'm going to say we really need the legislature to keep the law as is. And thank you for your consideration. Thank you.
Okay, thank you. And next.
Thank you, Madam Vice Chair and members of the committee. My name is Callie Schmitz with the Maryland Center on Economic Policy, also here in opposition to House Bill 1434. The bottom line for us is that we believe that Marylanders whose benefits are stolen should be able to count on those essential funds being restored, whether it happens at the beginning of the fiscal year or the end of the fiscal year. And passing House Bill 1434 amends this program that is currently working well in a way that puts that security and guarantee at risk. The ability to have these benefits affects people's basic economic security. When people can't afford food or rent, that has implications not only for that family, but also for the broader community and for neighborhood businesses. As Senator Kramer was indicating in his questions, we do think that this is premature. There is more work to do and work that can be done to improve the security features. The way to reduce the cost of this program at the end of the day is by preventing thefts from happening in the first place. EBT cards do not have the same security features that our bank cards have or our credit cards have. That is starting to change, but it's going to take time to get there. And it's really essential that people can have their benefits restored in the meantime. And just a quick note on the budget pieces. As the secretary noted, the governor did put sufficient funding in his proposed budget, 27.5 million, I believe. The Budget and Tax Committee did reduce that by 7 million on the recommendation of DLS, which said that would still be sufficient for what they expect the theft to be. But again, that's creating additional risk. And we think that the family should not be the ones bearing that risk. The state has procedures through deficiency appropriations and other means as they've used in the past, this and similar programs. So we'd ask for an unfavorable report. Thank you.
Thank you. Okay, next we have.
Hi, Vice Chair Klossmeyer, members of the committee, thank you for the opportunity to testify in respectful opposition of HB 1434. My name is Lona Muckle, and I'm the Senior Policy Associate for the CASH Campaign of Maryland. CASH stands for Creating Savings, Assets, and Hope, and we are a nonprofit that promotes the economic advancement for low to moderate income individuals and families in Baltimore and across Maryland. I would like to echo the concerns of my colleagues around the impact of this bill on our clients. We cannot support a bill that would negatively impact our clients, especially after they have gone through the unfortunate situation of having their benefits stolen. CASH has been working with DHS since last year on various topics, and we are committed to continuing our work in partnership with them over the interim. Advocates are also eager to have greater conversations on how to lessen the amount of people who are having their benefits stolen, and until we have stronger security measures to prevent EBT theft, we must ensure that our clients will be reimbursed. We also appreciate Delegate Lewis's dedication to this issue and her willingness to have open conversations and collaborate with us this session. We know what partnership looks like from our experiences with DHS and with Delegate Lewis, and we know that when we come together, that we can make sure we have policies in place that protect the state and protect low-income families that live in Maryland. For these reasons, we urge an unfavorable report for House Bill 1434.
Okay, thank you. And next we have.
Good afternoon. I'm Michelle Medeo. I'm an attorney with the Homeless Persons Representation Project, and I direct our economic justice program here in strong opposition to HB 1434. I just want to be really clear. If you vote in support of this bill, there will be people who have their benefits stolen who will not get reimbursed. This does put us back potentially to where we were in 2022 when there was no reimbursement law. The current law is working well, and we don't need any changes. Families who receive these benefits to qualify have such little income. So when your benefits are stolen, there is no savings. There's nowhere to turn. That's what the department's job is to issue benefits, make sure eligible households can receive them. The reason over 35 organizations oppose HB 1434 is because it removes the statutory obligation of the department to reimburse stolen benefits if appropriated funds are exhausted mid-year, which could happen because the bill does not require a minimum annual appropriation. Just to give an example, with this fiscal year, about $8 million was budgeted for reimbursement of stolen benefits, and to date, the department has reimbursed over $22 million. If HB 1434 had been the law, the department would not have been required to reimburse that difference of $14 million. It's worth highlighting again that the Senate unanimously passed this last year, and the reasons for needing the law still exist. We wish the EBT cards one day are going to be more secure with the chip technology. The department predicts it will take at least 18 more months to implement that technology. And so we're still in the same situation we were when we needed this law last year. Marylanders' benefits are getting stolen, and they need to be guaranteed reimbursement. Thank you. We urge an unfavorable report.
Thank you very much. And now we have.
Thank you, Madam Vice Chair and members of the committee. My name is Lisa Klingemeyer. I'm the Executive Director of Maryland Rise, which works to promote economic opportunity for all. We're here today in strong opposition, respectful opposition of HB 1434. I am your classic competitive perfectionist oldest daughter. So in high school, in driver's ed, I missed one question that kept me from 100. So I have never forgotten the question or the answer. And the question is, when is it the most dangerous time to apply brakes to a car when it is raining? And the answer is when it first starts raining is the time that is most harmful to apply brakes. And I feel like that is what this bill is doing. This program has been working exceptionally well. We just passed this last year. We're excited about the work that's been done and have been a partner in that work. And we see that there are storm clouds ahead. We know there is budget uncertainty and structural deficits, but we have the tools and the partners and the administration capable of coming together and working to address those. But we do not need to be changing the statute this year when we can come back next legislative session if the worst case scenario happens. If this bill passes and the funds are exhausted, like my colleagues mentioned, it moves the uncertainty and the risk from the state. In current law, if the funds run out, it's the state's work to figure out how to give funds to families who have had their benefits stolen. If this bill passes, it shifts that risk and it shifts that uncertainty onto the families and instead asks them to look at their exceptionally small household budgets and try and make their household budgets work. We do not believe we should be shifting that risk. We don't believe this bill is necessary at this time. We're happy to continue being a partner at the table and coming back next session if the storm clouds roll in and we need to find an off-ramp. But we think this bill is much too soon and respectfully request an unfavorable report. Thank you.
Thank you.
Yes, thank you for this opportunity to testify in opposition to House Bill 1434. My name is Gloria Brown, and I'm a staff attorney with the Maryland Legal Aid Bureau. Every year on a statewide basis, Maryland Legal Aid helps SNAP and cash recipient benefits and hearings before the Office of Administrative Hearings. In 2022, as you know, we received many complaints from clients who had SNAP and cash benefits skimmed from their EBT benefit cards. And they said that DHS would not reimburse for these stolen benefits beginning in the spring of 2022. In appeals before OAH, the judges consistently offered deep sympathy for the theft, but stated that the action transmittals prohibited OAH from ordering reimbursement because there was no funding. In 2023, this changed and Maryland enacted sweeping reform requiring reimbursement. Though the governor has requested a large amount to cover these claims, if the budget is cut, then we'll have reverted back to the 2022 policy, and our clients will again be left without reimbursement. And this change would impact the most vulnerable constituents in Maryland. Statistics confirm that most SNAP benefit holders are children, the elderly, and the disabled. They are made more vulnerable yet because their benefits are deposited on antiquated EBT cards that have no microchip technology. DHS expects an 18-month rollout before security measures are adequate. Also, although the government has started sending texts to clients who have access to the internet, the clients can't block the purchases as they happen. If someone uses the EBT card information in Florida, for example, our client now receives a text message, but does not have the option to block the purchase, unlike in the banking industry. Stopping this theft will save millions of problems and possibly resolve the budget issue. We ask that you not enact House Bill 1434. Thank you again.
Okay, we have one virtual and then we'll open it up for questioning. So.
We have two virtual
Oh, two? Oh, I'm sorry. Erica, is this Erica?
Yes, ma'am. Can you hear me all?
Yeah, we see you and hear you.
All right, thank you. I'm Erica Whitney Young, Baltimore City resident and community liaison with New Era Baltimore. I'm speaking in opposition to House Bill 1434, which would take away the right of Marylanders to receive reimbursement of food and cash benefits when a theft occurs and deny valid claims for reimbursement if funding is not available. It's important that we are mindful and empathetic to the many hardships that put people in a position where they need cash and food benefits. Years ago, I was homeless with 2 small children, escaping a violent marriage. Though I was working, I needed extra help. With the cash allotment, I was able to secure housing, pay my bills, purchase necessities, and prepare healthy meals for my children. It created a pathway for the financial independence and stability that I have today. But I am concerned that many customers, especially Baltimore City Department of Social Services users, are not aware of the reimbursement. I witnessed a clip that played inside all Baltimore City DSS offices that suggested that people experiencing benefit theft notify the police, request a new card, and create a stronger passcode. This played from 2022 until it was taken down earlier this year. There are families unjustly suffering at no fault of their own. A lapse in benefits could set off a chain of events that could cause a family to fall behind in their obligations. It may place a family into the same circumstance they were striving to overcome, such as debt, homelessness, and job loss. Please vote against House Bill 1434 and help families thrive. Thank you.
Okay, it's time to open up for questions.
We have one more.
Oh, I keep forgetting. I'm so sorry.
It's okay.
We
Can you
had
all,
two. Okay, you're fine.
all right, can you all hear me?
Yep.
All right, great. Good afternoon. My name is Ashley Woolard. I'm the lead attorney for the Health and Benefits Equity Project at the Public Justice Center. You have our written testimony. As a public interest attorney, one of the greatest joys in my work is being able to tell a community member who comes to me during one of the most difficult seasons of their life that the law is on their side. Since April 2023, I've been able to tell individuals who call us when they've had their benefits stolen that Maryland's law is on their side. This is why we strongly oppose House Bill 1434. This committee responded to a national crisis by passing what is now the strongest reimbursement law in the country. We didn't think we'd be here again less than a year later to defend that new law that has saved tens of thousands of households from hunger, having their lights turned off, and meeting other basic needs. We cannot balance the budget by making the right to reimbursement discretionary and subject to appropriation. We can't do this when the clear root of this problem is the lack of security protections for EBT cards. The new law is working well, but there have been significant barriers for households to getting full reimbursement during the rollout. Many benefits recipients, including one of our clients, Vanessa Fleeton, were not fully reimbursed for their stolen benefits as required by the new law. Ms. Fleeton had nearly $2,500 in SNAP benefits stolen from her account last summer and was reimbursed only $46 initially. We've shared links to her story in our written testimony from Baltimore Banner articles. We continue to receive calls from individuals who are still not receiving their right to automatic restoration of their benefits in the amount stolen while they wait for their appeal hearing. To put it bluntly, the department has not been complying with the full and explicit requirements of the new law. It is too soon to carve away at something that is so vital to our poorest residents, especially when we haven't even seen the law work at its full potential. Maryland was the first in the country to guarantee this right, and we cannot be the first in the country to take that right away. Thank you so much for your time, and we respectfully urge this committee to give HB 1434 an unfavorable report and preserve this life-saving entitlement.
Okay, now we can take up some questions. If you would like to stay on and see if anyone has any questions for you, but at this point, we have Senator Kramer, and he's going to ask a question to one person.
Thank you, Madam Chair. And yes, just one of you, please be kind enough to respond. First of all, I think we all very much appreciate the commitment of this governor and this secretary to this issue. I think my concern is that if we make this change now, we're maybe being premature, and we will not always have this secretary and this governor fighting the good fight on the issue. And we could end up with an administration like the one that preceded the current administration that steadfastly refused to act at all on the problem. So would you agree that perhaps we ought to wait and see what happens, and then we can revisit the issue next session? And also next session, we can make that priorities decision as to what our budget looks like. And if in the case of these stolen benefits and our most vulnerable being harmed by the theft of their benefits, we will then be in a position to make that decision as to what our priorities are and either fund it from state funds if we lose Fed funds, or take a look at it and go, okay, we need to pursue legislation like this simply because we're not in a position to do it. but at least we hold off until we know, and that example you gave of, hitting those brakes right when the water just loosens up the grease on and oil on the streets is when you're going to go skidding off the road. That let's wait and see. Would you agree with that? And that maybe that would in fact be a prudent way to approach this?
Yes, I believe I think I can collectively say for all of us that we would absolutely agree with that. The current administration has been a great partner in this work, and we know it's not their intent to cause harm in the program. I think our concern is that there's still an impact. So your intent isn't harm because this administration has been putting in the resources for this program. But if a future administration is not on the same page, since the statutes now changed, they could put $0 in and there'd be $0 for this fund. And the impact of that would be harm. So absolutely, we're partners in this work. We would love to continue having these conversations and come back next session when we have a better understanding of kind of where we are in DC and our own state budget, but we don't believe this legislation is necessary this session.
Thank you. Thank you, Madam Chair.
Okay, Senator Reedy.
Thank you, Madam Chair. And I probably just have one person answer on the panel, but last year I voted for this bill. And so we're back here again. And I'm looking at the report that has come out that ran from March 1st, 2023 to October 31st. And I guess almost all of you in your testimony talked about people through no fault of their own have had this happen. And I would agree if somebody is robbed or has had something skimmed on a machine, that's probably through no fault of their own. But you're telling me that 27,000 households had it stolen directly from them, or 27,000 households have had some combination of theft, losing it. They can't really say what happened to it, but it was stolen. Can somebody elaborate on that?
Yes, Senator, thank you. I can. So when I'm not in Annapolis, which is most of the time, what I do is I represent people who disagree with different decisions of the department, like benefit closures. And so we've had a lot of clients who have experienced theft, and I've represented them in appeals. My job has gotten much easier with this law because everyone, should be getting reimbursed now. But I worked with a lot of people who weren't. So what we see is most of the clients we've worked with, the theft, it's, most of it's the electronic thefts. You have the EBT card on yourself, and without any knowledge to you, if you have swiped the card on a machine that has been tampered with, which now that I know, I'm like looking, it's very hard to detect, even if you know what you're looking for. If you've swiped your card, you don't get any alert that your card has now been tampered with. But if it's
and why not? Because we're not there on the technology. We're working on it, as the secretary said. Is that why do we not get an alert? Why doesn't somebody get an alert when that happens?
I don't know if the department even knows if the card has been tampered with in that moment. I think from my experience, no one really knows there's a problem until the benefits are being spent.
Okay.
On, fraudulent spending. In a lot of cases, it's really easy to detect because if you live in, somewhere in Maryland, let's just say Baltimore, for example, and you don't have a car, and you only ever go to the same ATM or corner store, your transaction history shows your spending patterns. So to all of a sudden then have charges in California, Arizona, or an ATM withdrawal of your entire balance in the middle of the night, very suspicious activity.
And they have to provide that with what do your clients have to provide to prove that it was stolen?
So the nice thing about the law is the burden is not on the client to have to prove it because it's very hard to prove. I mean, the way my clients find out is they go to the grocery store, they have, all their groceries that they need for that week. They give their card to the cashier and they're like, there's no balance. And that's the first they learn that something's wrong. Then they go back to the department. And if the department can then pull up the transaction history, they'll say, oh, do you know you withdrew all your funds at 2 a.m. in Arizona? And they'll be like, no, I was at home with my kids.
What's happening if the department pulls up and said you withdrew all your funds in Annapolis, if you live in Annapolis, or Baltimore, if you live in Baltimore? Is there... My concern with all of this has always been, I know some people are being victimized. A lot of people may be being victimized. When we say through no fault of their own, how much of this is, I know the department you can do a secure PIN. You can do, there's other things you can do now. And I know people need to be informed of that. I guess I'm almost coming at this from the other angle is, I'm I definitely want people to get money back that were benefits that they had, but at the same time, this seems like a lot of people and a lot of money, and it seems hard for me to understand why it's happening. But if there is an issue with machines, I think with secure, we need to, and I think the department mentioned it, and we can talk offline to the department, we need to start preventing this on the front end, which I know everybody, I'm sure everybody agrees with. I guess I was just trying to understand. So they really don't have to prove anything, though. They could just say it's stolen. There's really no check, or the department has to do.
The department has to do an investigation. They've actually assigned 2 special units to it. I think it's in Garrett County and Allegheny County. And those units are trained on how to review. I actually had a case just last week where the client, her reimbursement request was denied because the charges were in Maryland. We filed an appeal. And then upon further review,
They were able to show that
they actually, I was impressed at like what they look at, and they were able to tell that someone had done a card inquiry balance immediately before the withdrawal, and my client had never done that. So that was one thing. It was ATM she had never used before. It was at 4 a.m. and she has, young children. So they definitely have a protocol. We like to say through no fault of their own, only to counter the harmful narratives around public benefit recipients, and just to make it clear that, when you have an EBT card, unfortunately, you are a second-class consumer because it lacks the security protections that
which we need to try to
cards.
change, which is not really, that's a longer
Right.
conversation. And I've never been one to, I'm asking the tough, what I feel are good questions, because I just want to be sure we can be accountable for what's happening. But I'm not somebody who picks on SNAP and all that. I think we need to help people. That's the way we can help people. So I'm fine with that. I just wanted to be sure I better understood some of this, and bringing it back to me. I wanted to better understand why we're getting so much of this and why we can't do more on the front end to stop it, which we just need to keep talking about. But that's maybe a little bit separate from the reason everybody's here today. I understand. I just wanted to better understand it. So thank you very much, Madam Chair.
Can I add one more thing?
Yeah, please.
Thank you. The law from last year, which again, thank you to this committee. It had some uncodified language with very specific security recommendations for the EBT card. Most of those are not actually implemented yet. Things like the chip card, it was supposed to be on or after October 1st of 2023 to implement the chips. That will significantly reduce theft. There's also a recommendation to prevent out-of-state purchases. So if you know you're never going to leave Maryland anytime soon, you can actually prohibit out-of-state purchases. That would reduce a lot of theft. You can prevent your, another option, which is again, not yet in Maryland, is to prevent your card from being used in the middle of the night. So again, if you have young children and you're not leaving your house from the hours of 10 p.m. till 6 a.m., stop that. Other like having the department review for suspicious transactions. It's in the uncodified language, and I referenced it in my written testimony. I think, going back to Senator Kramer's question, it really is too soon. I would like to see a lot of these security protections actually implemented on the EBT cards, and then would love to come back and have the conversation again. I really think that will reduce the cost of reimbursement once we stop the theft.
Okay.
Thank you.
All finished? Anyone else have any questions? Okay, thank you all very, very much for everything you've done here and you will continue to do. And that ends this bill hearing, and that ends the bill hearing for today. And we're going to take a brief pause, and then we will be voting.